All right, this is White Coat Medicine Talks. We're back again. Today we're going to talk about several things. I want to ask you, you may have several patients with cirrhosis, don't you?
Yeah, actually, I remember one that you just mentioned this past week.
Yeah.
Super young.
They're very young right now.
Yes.
Some of them are young.
And like, you're probably thinking, like I am, they're not just from alcohol?
They're not just alcohol. It's not just.
It's getting a little scary, dude.
It's getting scary. I have a few patients. Basically, yeah, cirrhosis. Of course, the liver just pretty much turning into a rock. And then, if you think about it, your blood has to flow through there. If it can't flow through a rock, it goes everywhere else in your body. So then your spleen gets big, your veins get big, you bleed out. It goes into your belly, and so that's why you see all these different problems with that. But and that's why alcohol just kills the liver, right? But now we're starting to see the fatty liver from really our diets or diabetes or anything else that's going on, and it's like it's bad.
It's bad. The non-alcoholic liver cirrhosis that you're talking about is very prevalent, and sometimes it goes into families. I've had a family that I think like all their sisters had it, and then they would tell me, no, she died of the liver, and I was like, what do you mean she died? Oh no, she died from cirrhosis. And then I started realizing it, definitely not alcohol, because these ladies don't drink, and these sisters who've been telling me the story, and I've been following them. Out of the 5 sisters, like 2 are left, and I realize they're doing everything they can to try to reduce that sclerosis from occurring.
Yeah.
So, from aggressive dieting, and sometimes, like you said, they either get this diabetes or it's just ingrained so hard that if they didn't start early, David, it's going to be so hard to slow it down.
Yeah, it's going to be hard to slow it down. It's really hard.
Do you give anybody anything like meds and stuff?
No. Usually, when we have people with cirrhosis, I definitely get them to see the gastroenterologist quick, because we just want to make sure that we rule out anything else.
Yeah.
And we know the hepatitis viruses cause the cirrhosis as well. But a lot of these people
have now a treatment.
Right. We have Hep C treatment. Hep B treatment is coming up.
Is also something.
Yeah, they're really studying, and it's kind of moving on. That company is really
doing well.
Well, it's doing well, but as money-wise, they're not doing that great. So that's a bad thing. So hopefully that's going to get through, and they're going to push that treatment through. So hepatitis B treatment is coming. Hepatitis C treatment is already here.
Yes.
But when it's not the hepatitis viruses, it's your diet, it's just a fatty liver, it's not taking care of your diabetes, it's eating too much sugar, too much flour, too much everything, and so
just clogging up in there and making it so hard to flow, like you were talking about that rock. And it's amazing. People can die as a person who drank alcohol.
And they are making medications also for fibrosis of the liver now, to break it down, so they don't get all the fibrous tissue. And hopefully it helps it. But
is it true, what you've read, that you could live with a little bit of a amount of liver? Because that's one of the questions I've always wondered, from what I've read, is that I don't know the size, obviously, but if you have enough something flow, you can still
you can survive it, and liver regenerates. But except the only problem is that when you have all this dead tissue around it, it's really hard to do anything, and it might kill you before it kind of helps you in any way.
Other way.
So that's a bad thing. But what's your recommendation for all these people that you see with cirrhosis?
I think if it's the non-alcoholic liver cirrhosis, it's like strict diet, and what I like to do a lot of the times, David, is get an ultrasound before and then one after. The one after is those that really worked hard and lost weight and wondered, did I get better? And I have seen less echogenicity or less amount of fatty. So it's a visual to show that it's improving. That's the number one. There's meds, but I'm not really big on the meds. But like you said, make sure that it's not any liver problems that need something.
Something urgent, something
like a biopsy or.
And a lot of times they require biopsies and stuff like that. So that's The liver cirrhosis is tough. It's tough to deal with, and it's hard when people are ingrained in when it's alcohol and they're really stuck in drinking, and you remind them every single time that they're gonna die from it, and they don't stop. It's hard. It's hard to deal with, and you just try your best.
Have you had patients that you had to talk to about drinking, and it seems like almost some of them are almost futile.
Yeah, they're not going to change.
They're not going changing, but
yeah,
there's some that really try hard, David. Because I know that
there's some people that try really hard.
Yeah,
and that's great. And I think we have to motivate them and keep on motivating them and making when it's like when you're in school, man. You get positive reinforcement. It's a good thing.
It's a good thing, yes.
I mean, I don't say you positive reinforcement in different ways, but just knowing that their labs are better, like their ultrasounds are getting better, they're living better, they're feeling better. All these things that can happen when you make changes.
Especially with alcohol.
And if you stop and you have a little liver left, you give it a chance to work for you.
Exactly. And I was just thinking about, like, a lot of times I'll go back in and say, there's obviously a reason they're drinking.
Yeah.
And try to help them on that aspect part.
Yeah.
And then there's that, the organization that's worked forever, Alcoholics Anonymous, is where I've seen a lot of people say, those that have been through it are the ones that are going to pull you out of there.
Yeah.
And I never believed that at the beginning, because I guess I just didn't see enough until, like, as the practice grew, I finally started seeing that work together. Somebody that has been there and got out of there knows how to help you get out of there and work through the issues you have. Maybe not the problems are the same, but you tend to just stick with people that
can help you through.
That can help you.
You just don't want to fall back into it.
Exactly, because that's what happens.
But there's hope, and any time that you have issues, when patients have problems with these cirrhosis or drinking problems or eating problems or anything like that, it's important to let us know what's going on in your life. Be honest about what's happening with you, so that we can try our best to benefit you. There are programs, there are different things, there are different treatments, like Dr. Hornedo was saying, that now we can offer, and hopefully we can stop the progression of cirrhosis and of the hepatitis viruses causing the problems, and we can keep on getting better.
Exactly.
All right, man.
I like that. Good
All right,
job,
for White Coat Medicine Talks, it's Dr. Hornedo and Dr. Cruz. I almost forgot your name since I haven't seen you so long.
Great seeing you, buddy.
Thank you, guys.